According to data drawn from UNICEF in 2018, nearly one-third of the Nigerian population is between the ages of 10 and 24, and one of the major contributors to Nigeria's population growth is the high birth rates among young people between the ages of 15 and 30, with the low usage of contraceptives as a leading factor. Young people between these ages are more sexually active than older people, and without the use of contraceptives are susceptible to be involved in unsafe and sexual activities. Healthcare facilities are structured to provide sexual and reproductive information and services, but the healthcare providers, for fear of promoting promiscuity in the society, stand in the way of young people accessing this information and services. The implication of marginalizing this group has not only led to the increase in unintended pregnancies, but abortion, which is yet unsafe due to the restrictive abortion laws in Nigeria.
Now, I think it's important we take another look at the abortion policy in Nigeria, because the current abortion policy puts adolescent girls and young women in a disadvantaged position. Why? Because if an adolescent girl or young woman wants to get an abortion performed, for example, there is no way to carry it out because the law restricts abortion to be performed only when there is a need to save the life of the woman is threatened.
2018 to 2020 Performance Monitoring for Action (PMA) study found that 4.6 of reproductive aged women undergo an abortion each year, equaling nearly 2 million abortions annually. The majority of these abortions are considered unsafe as they involve non-recommended methods, that is, something other than abortion surgery or medication in non-clinical settings. Such unsafe procedures contribute to 10% of maternal deaths, equivalent to approximately 6,000 women dying each year. The healthcare system is not totally functional if the health of young people are not prioritized. The public healthcare system and the primary healthcare centers were instituted to provide the first line of care and possess great potential to sustain youth-friendly sexual and reproductive health services, particularly because they already exist within the communities, receive government support, and are by definition more stable than private facilities. But limiting the provision of information and services to meet the needs of only pregnant women for antenatal care and children for immunization services will not achieve the purpose of their existence. The absence of a framework for adolescent and youth-friendly health services in these facilities reflect the stigma associated with accessing sexual and reproductive services, thus creating an environment for young people to practice unsafe sex, which defeats the prevention of sexually transmitted diseases and infections or unintended pregnancies.
We need to look at this policy and then come up with a framework that helps healthcare practitioners provide better services to this particular population, particularly training healthcare workers or service providers to render youth-friendly services. This way we can bridge the gap between adolescent girls and young women, and of course the service provider, and then reduce the incidences of patronizing quacks or fake practitioners who use whatever means it is to provide services to these adolescent girls and young women that result in negative health outcome.
Great progress can be made to achieve the optimum health of the Nigerian youth if abortion policies are restructured to consider the health of young people, setting up a framework for healthcare providers to provide information and youth-friendly health services, especially in primary health facilities that will cater for young people's sexual and reproductive needs.